Good day. We just finished our panel on transgenderism in the new millennium. So it was a very fruitful discussion. We had Dr. Basubas, our psychiatrist, Dr. Perez, our endocrinologist, Julia, our advocate, and as well as Dr. Florge, our ethics. So we were able to have a good discussion, and we hope that you will look into their insights and look further into transgenderism into the new millennium. So thank you for listening.
We talked about a couple of points. The first thing is ruling out certain endocrine conditions before proceeding with treatment for transgenderism, ruling out conditions such as congenital and renal hyperplasia, virilization, testicular feminization. After we ruled out these conditions, the next step is treatment after discussing with a multidisciplinary team. For transgenderism, male to female, we will be dealing with increasing the estrogen levels, and for female to male, we will be increasing, the desired goal is to increase the testosterone level. It's a complex discussion, but we have to be very well aware of the benefits, what are the desired effects, but we have to be very well aware of the risks of all these medications. Thank you.
So during our panel discussion, as a psychiatrist, I would like to point out that there needs to be a thorough understanding of what being a transgender is, because it is an umbrella and a broad term for so many other things that are considered in LGBTQIA+. So what was discussed there was about the understanding, eradicating the stigma, and the processes involved before an actual transitioning can take place. So we discussed, and I would like to stress about the steps employed by the University of Cambridge, whereby first and foremost, there should be a thorough understanding of the procedure, the side effects, long-term and short-term. Then this will be followed by the thorough mental status evaluation in order to identify any psychological or mental health problems, and of course, trying to document if there is really a case of gender dysphoria. This is then followed by the examination and the real life situation, whereby now the one who likes to transition will be living the life of the opposite gender for a full year before the process can go on.
3 parting messages. First, gender identification has a broad spectrum wherein people really sometimes would not understand where they are, where they stand. So it's very important for us to understand what it really is, what it really means to people who are within the spectrum. Second point, in the point or the public health point of view, trying to understand this spectrum would help us alleviate the issue on HIV/AIDS. The reason why HIV/AIDS is on the rise is because maybe we don't consider addressing these issues on that aspect. And then on the third, we also, for personal reasons, we have to really understand what we are going through, try to improve our health-seeking behaviors, since most of the people within the spectrum are don't have a good health-seeking behavior on that aspect. So are we really ready to tackle this problem when we are in the situation? So that's it.
Transgenderism falls into one of the things that are just so difficult to understand. LGBTQA plus A, very difficult to understand. So from the ethical point of view, the first step we should be to gather the facts, to be able to understand these things, the implications, the ramifications, the ins and outs of transgenderism. And aside from that, we have to also look into the stakeholders, the different stakeholders, not just the patient, because this is a lifestyle change and the patient needs support system, such as the family. The third is that we have to also identify the key dilemma here, the dilemma, how the case should be approached, and then explore alternatives, weigh down the values of each alternative, and then we also write down the consequences of the alternatives. If we proceed in this particular direction, what are the consequences? And after everything is deliberated, then make a decision on how to proceed not forgetting one of the most important things that we need to factor in, that we're doing this for the good of the patient. That's very important from the ethical point of view. Thank you.